Hello, I am Dr. Richard Johnson, Dr. Richard Johnson, Director of the Booker T. Washington Initiative here at the Texas Public Policy Foundation. First, I would like to introduce Dr. Larry Bell with University of Houston, who will introduce our distinguished guest to talk today about the impact of COVID-19 on historically Black colleges and universities. Hey, Larry.
I'm going to have to use, I'll use my phone to connect in here. But I want to thank Richard Johnson for putting this together. He's really the one that orchestrated this and participated in an earlier panel as well. And he selected the excellent panelists we have today. The Texas historically Black colleges and universities have a variety of very significant and difficult problems related to COVID over and above the problems and issues of many other universities and colleges. And that will be the discussion today. So I want to thank Richard for putting this program together. We have excellent participants today that are very much involved and leaders in this issue. Dr. Adena Loston, president of St. Phillips College, Kenneth Huewitt, interim president of Texas Southern University, and Dr. Glenell Lee-Pruitt, who is the provost and vice president of academic affairs at Jarvis and Christian College. So with that, I'm not going to take any more time, and Richard perhaps wants to say more about the speakers. But I think this is a very, very important program because the HBCUs are so important to Texas and to the nation. Thank you very much.
Thank you, Larry. We're going to dive right in and talk a little bit about the COVID-19 impact on HBCUs. I want to thank our distinguished panel. Thank you, Dr. Loston, for being with us today, Dr. Pruitt, and President Huewitt. I want to just talk a little bit about what the production of HBCUs before we go into the discussion on the impact of COVID-19. HBCUs represent 42% of all of the Black engineers, 80% of Black judges, and over half of the Congressional Black Caucus are produced by historically Black colleges and universities. And of the 100 HBCUs across this country, servicing on an average of 228,000 African-American students annually, 75% of those students are on Pell Grants and 90% are on some form of financial aid. And this was before the COVID-19 pandemic. And I want to just say to Dr. Hugh, I want to bring Dr. Loston in first. In terms of preparing your faculty and preparing your students to make that transition, dealing with COVID-19 from person-to-person in-face classes to online classes, tell us a little bit about that transition at St. Phillips College and some of the struggles that we all had to go to, and I know you're going through as well.
Okay, thank you, Dr. Johnson, and as a former employee at St. Phillips College, thank you for allowing us to be a part of this presentation this morning. But to talk about what we are doing at St. Phillips College, we approached it, I can say, from many different areas, and I'll talk to you about from campus engagement, what we're doing, the communications plan, the connectivity plan, as well as the advocacy for students. When we entered into this COVID environment, we came up with, we entered into an incident command protocol where we defined phases of how we would approach dealing with COVID. Phase 1 being 100% of the students are on the campus. Phase 5 being stay safe, stay at home. We immediately went to stay safe, stay at home in March. But we're now in phase 4, where we have roughly only the critical students and employees that are on the campus now. And I can say more about that later. But I also want to talk about, in terms of our communications plan, we developed a dashboard of roughly about 45 critical elements. There are 3 vice presidents. The vice presidents identify critical areas that we must address to bring the students back onto the campus and to engage, to transition the employees as well from face-to-face to working in a remote environment. So in identifying those critical elements, we have a dashboard. We established a dashboard with roughly 45 elements where they're rated, assigned ratings of red, yellow, green. So we know exactly where we are at all points in time and addressing those critical elements across St. Phillips College. We also have, in terms of communications, not only the dashboard, but we have a call to conversation, and that is done on a monthly basis, led out of my office from the president, communicating with all employees what the status is and where we are relative to COVID employees and how we are addressing that on the campus. When we're talking about connectivity, well, everybody had to go home immediately. Some people had laptops at home, some had none. For those that had none, we said, take your desktop home so you can work from home. And then ultimately, we purchased more than 900 computers, laptops for employees, for students, and then over 600 hotspots that people could use because we realized that there were connectivity issues in the home. But for most immediately, we made our parking lots available because we are Wi-Fi enabled across the campus, and we're telling the students, come to the parking lots where you will have immediate access to Wi-Fi so you can stay connected and be connected. And we did some rudimentary things, recognizing that distance learning may have been at that point in time starting out just on the phone, connecting with the students if they didn't have the connectivity. And we also, in terms of for the students right now, when we're talking about what is us, some of the things that we have done, we started communicating with them through soft phones and making sure that our certified advisors had a way to connect with the students. In addition to that, we realized that students were struggling, people were unemployed, so our advocacy support has continued to be in place, where those students that are struggling with homelessness or hunger, we're working to address that. So that's the big picture in terms of how we're addressing it, from connectivity to communications and to establishing protocols, but definitely knowing, communicating with the entire St. Phillips College community about what we're doing, what those critical elements are, and how we are addressing them to alleviate anxiety, concerns, fears, trepidations about what is happening, and we have no control. We wanted to remove that element and demonstrate that we are disciplined people taking disciplined actions in the midst of a pandemic as best that we can to give guidance to the employees and the students.
Thank you, Dr. Loston. Dr. Pruitt, Jarvis Christian College is a private college, historically Black college, and it operates a little bit differently than some of our public schools. Could you tell me a little bit about how you're dealing with connectivity, remote learning, and student engagement at Jarvis Christian, and how has COVID-19 impacted that? I can't hear.
Thank you, Dr. Johnson, for this opportunity. And on behalf of my president, Dr. Newman, I also extend his thanks for allowing us to be a part of this. At Jarvis Christian College, what we discovered as a result of COVID-19 was the true impact of the digital divide in this country. That disproportionately impacted our students. As most institutions had to go virtual immediately, abruptly, we had to send students home, faculty were no longer on campus, we realized that we had students who were struggling with what Dr. Loston termed connectivity and what some are calling internet inequality. And so that was a very big challenge for us here at Jarvis, because that impacted how students were able to connect with faculty as it relates to instruction. And so one thing that we knew instantly was that we were going to have to work with our faculty in order to help them understand the challenges that our students were experiencing. One thing we found out about being small, being here in a rural area, is that not only are we an emotional and physical safe space for our students, but we're also a digital access space for our students. And as a result of us having to transition so quickly, we realized that we had to do something as an institution in order to make sure that our students had the access that they need to continue their education. And with that in mind, we began to work with faculty specifically on understanding that our students are accessing their classes, usually on handheld devices, which means there were some limitations, as well as helping them to understand that our students did not have the necessary resources that would be necessary for them to be able to connect, and therefore them having to come up with alternative ways of connecting with our students. I would like to share that we immediately began to utilize Zoom in order for faculty and for our student support services staff to connect with students. Our students had a lot of challenges, and we can talk about that a little later on, but they had challenges with getting affordable food, challenges with health food, challenges with being in a safe environment. And all of that helped to highlight it, enlighten all of us on the impact of COVID-19, even pre-COVID-19, some of the disparities that our students were experiencing, but they were definitely multiplied during this COVID-19 pandemic. And those are issues that we had to take in consideration and have to take in consideration as we're serving the students that we're serving.
Thank you, Dr. Pruitt. President Huewitt, your expertise is in educational finance, and the statistics show us that African Americans have been disproportionately affected by unemployment and the economic impact of COVID-19. How has that affected enrollment, and how is that affecting your institution from a financial or economic impact, adverse impact to the institution?
Well, thank you. And again, I appreciate you putting this together. I appreciate being here with my distinguished colleagues. One I hadn't talked to in about 8 months, but good to see you. Yeah, as you stated, the community we serve, those students and their families are the ones that are, quite frankly, some of the essential workers, or even some of the workers that have gotten laid off or lost their jobs, if you will. And so we anticipated, just based on that, that our enrollment would go down a little bit, just because of how this pandemic was affecting Black and Brown communities, and with a significant portion of our students being from those communities. But we anticipated maybe 13, 15%. And we had talked to those students. We had talked to our applicants as well, about, are you still coming or whatever? And what we heard were, we're concerned about this virus, this pandemic. We're going to stay closer to home. We're going to take a gap year. We're going to go to community colleges near that where we live. And so seeing that or hearing that, we knew that we were going to potentially have a decrease. We anticipated 13 to 15%. It's closer to, it's just a little more than 20%. And again, due to the length of time that this has gone on, I think due to the modality of the teaching that we're doing, as far as we started off totally online with the intentions of going to a hybrid model in September, which we did September 14th. But when we shifted, as was previously stated, when we shifted or pivoted back in March to go totally online, it was totally disruptive to our students and our faculty as well. And so when we sent them away, as I heard earlier, we had students as well working from their mobile devices, trying to complete the semester. And so it was just a horrible experience for many. Thanks to our faculty that did what they needed to do to get up to speed, to finish the semester out in an online environment. We had to obviously get laptops to them and those type of things, because it was just, that's not what they were prepared for. I mean, everybody was working off desktops. We're an HBCU. We're nurturing the environment. That's what our students need. That's where we thrive. And to totally go away from that in a week's notice, if you will, was disruptive. And then we also, since we were still in this situation, decided, okay, we've got to get better at producing this online environment and this curriculum and everything, and we have to practice. And so we also decided to do that for the summer school, and our numbers for summer school dropped as well, because again, our student population isn't the population that wants to be online, and they want to be here on the campus and walking up and down Tiger Walk and enjoying, you know, one another, and that wasn't possible. And so when summer school actually dropped as well, the enrollment for summer school dropped, we anticipated again the drop down for the fall. We're looking forward to trying to get them back as soon as possible, as soon as the pandemic allows, if you will. But it has been tough. We've been fortunate to receive, and so we were able to reimburse ourselves for reimbursements that we had to provide to the students that we put out of housing all of a sudden, cancel their meal plans. I mean, those things were obviously financial impacts to the university, but we were able to benefit from the CARES Act. We also were able to provide those students their portion of the CARES Act funding as well, which helped them. But I tell you, when you all of a sudden just tell students go home, and they can't go home, and you have to help them be able to get home, you understand the severity of the impact of this and what our students' needs are. And so you know, we counsel, obviously once we went home, the student workers weren't continuing to work anymore. And those things, you know, impacted their bottom line as well. And so there's a number of things when you think about the finances of this pandemic, or the economics of it, it affected everyone. We're still hanging in there right now. We're positive, looking forward to the spring. You know, everything's changed though. I know the economics of sports and all those type of things and getting together, you know, all that's been delayed as far as Texas Southern is concerned, but we're looking forward to a very, very busy spring.
Thank you. I graduated from HBCUs 3 times. So folks always ask me, say, Dr. Johnson, why did you get your bachelor's, your master's, and your doctorate at historically Black colleges and universities? Simply because when I first stepped on the campus of Wiley College, I was immediately accepted into a family. Historically Black colleges are more like a family. You know, it's not like a university or something in the abstract. It's more like a family member, and then the faculty members become more like surrogate parents. And I was just wondering how this pandemic has impacted that family atmosphere that HBCUs pride themselves on since the very beginning. Dr. Pruitt, what are your thoughts about that?
Yes, thank you. One thing that my background is social work. One thing that I was very concerned about is how our students and faculty were doing during this pandemic. And so I took it upon myself once a week. I would send out communication to students just to check in. How are you doing? Is there anything I can do to help you? What can we do to help make things better for you? And I did the same thing with faculty. Because one thing that we wanted our students, our faculty and staff to know, that even though we were separate, we were not apart from each other, and that we were still here to support. And students would respond with what they needed. Students would respond with how they were doing. And I was able to communicate, and I continue to do that even now once a week, just to see how students are doing. I think it really helped to make students feel that even though they were not here, they were still a part of this community, and they were still very important to us. And so even with the fact that we are separate, we use various technologies to communicate with our students and keep our students engaged. And we want them to know that we care about what's going on with them as individuals, as people who, as students, as persons who were once in this cocoon of Jarvis Christian College, who now back into their communities where there are a lot of things going on.
Dr. Loston, how are you handling at St. Phillips College? And I'm a family member there at St. Phillips College and Texas Southern University. How are you handling it at St. Phillips College right now? Because I know the family atmosphere there between the faculty, staff, the support staff, and the administration and the students. They kind of all enmeshed together. How are you guys dealing with it there?
Well, thank you. We work very hard, and we're still working very hard in that we're making sure that there are no disconnects, that no one is disconnected from the college and the faculty and the staff. Let me say the first thing we did was after spring break, the students, we didn't bring them back that first week. We brought back all of the faculty. And we engaged the faculty heavily in professional development, learning how to do Zoom if they were not Zoom, and all of their classes were face-to-face, but infusing them with a robust professional development effort to learn how to communicate in a remote environment. So giving them that, making sure that every faculty member, 100%, had that capability for connecting with their students. And knowing that the students, if they had not heard from them, then they would reach out to call them via phone. And we were saying this is also distance connectivity if it's necessary. But we have made sure that we're able to stay connected with the students, because one of the things that we've done is we recognized that when COVID hit, a lot of students were disproportionately impacted. Over 500 students received I's because they couldn't complete their work. And so what we started doing is, even for the summer semester, we offered them waivers, giving them an opportunity to take classes in the summer semester and scholarshiping them, because we recognized that there was a great loss because some of them were planning to graduate in May. So we invited them all back. We have our certified advisors that are responsible for connecting with the students and staying connected with all of the students. They have their caseloads, and everybody is reporting out the success of making connectivity with their students. The faculty are reporting out how they're connecting with their students. And so when we gave the opportunity for them to come back in the summer to complete the work that they lost, we had over 21% enrollment increase in the summer. We also created an opportunity for those students, particularly the CTE students that must have hands-on. When they were disconnected, we gave them preferential opportunities to register. And we did that by reaching out to them, calling them, sending them postcards or emails to make sure that they felt connected and staying connected to them, because we didn't want to lose them and didn't want them to exit not having completed their career goal or the journey for a degree or certificate. So we've also given them preferential enrollment for the fall. And right now, our enrollment we're roughly a little less than 2% down from where we were this time last year, but we know we're going to even it out. because we still got Fall Flex 2, where students will be enrolling in approximately 2 more weeks. So we think that we'll be holding steady with our enrollment, if not increasing, to get back to where we were. The other things that we're doing is that we have a website, and that is in our website, we have a direct link to COVID, and in there it lists all the resources that are available to the students. Dr. Huewitt mentioned the CARES money. We provided funds available to the students who were homeless, who were hungry, that we gave them CARES money. We received a little more than 10 million, almost 10 million, I'll say, in CARES funds that we use that to support the students. So with the CARES, with that website, they know where to go if they're needing help and support. They know where to go if they're needing counseling, if they need to talk to a counselor or an advisor, we make that known to them. That website will tell them where to go if they're hungry and needing food support. We have an advocacy center, and the students, we're making food available to the students. We have the food pantry, but also we're working with the San Antonio Food Bank, where we have food giveaways on the campus, and we have one coming up roughly in about 2 weeks, where we're supplying our communities with food. We've worked also with Metro Health, where we're doing the testing on the campus, where the students can get, where employees and the individual can come to St. Phillips and get the COVID test. So through the website, we're making that known to students. We're emailing them, texting them, calling them to say, this is what's available to you. In addition to that, every division has a responsibility for staying connected with all of the individuals within that division. My president's division, which includes my office, PR, institutional advancement, and the Title III office, every Thursday at 2 o'clock, we're meeting, and we've been doing that since March, meeting with those individuals, not to talk about work, but to see how you're doing, how are you faring through COVID, and then allowing people to express whatever concerns or issues they have. But that is happening across the entire college in every division, where we're just checking on our employees to make sure that everyone is doing well. And everyone, I should say, every office, operational unit, has found a way to make themselves relevant during this time. Rather than throwing up their hands and say, we cannot fully function, they have found a way to be relevant and to be responsive, whether it's tutoring and providing tutorial services, how they're reaching out to the students and engaging them in Zoom sessions, or if it's our Child Development Center, where we have no children on the campus, but they're pushing out little lessons for 30-minute periods of time for those students that would have had their children enrolled in the Child Development Center. Every operational unit, division, department, office at St. Phillips College is responding or has found a way to make themselves relevant and to be able to respond. So we've done lots of workarounds. We've been very creative, very innovative, and that I am very appreciative for the staff in terms of how they have responded. But these are the things that we're doing in this family. We are a family, and we're making sure that no one gets left behind or forgotten.
President Huewitt, how's the family working over at TSU in terms of recruitment, persistence, graduation? Because I know that, being away from the campus and having some disconnect will have an adverse impact on student outcomes and graduation and persistence. So how is the Student Support Center working, or is there a need for additional resources for student support services, including, Dr. Loston just mentioned the academic advising, the advising staff, and other support staff, tutorials?
Yeah, so yeah, we're definitely engaged. I'll tell you, first let me say also that how our alumni has been engaged and just trying to figure out how they can help. When we pivoted and sent folks home and then started really kind of realizing the effect on our students and our employees, one of the things that we did immediately, we set up a Tiger Fund. and so that we could just have contributions from our even our employees contribute to this, but from our alumni and from others, so that we could just provide funding to our students for whatever needs they had. And they obviously they didn't have to justify anything. It's just they just make an ask. And so we did that. We also established a food pantry and chat bot and those type of things. But as far as when you get to the spring semester ending the way it did, and we weren't able to have graduation. We did a virtual graduation with our students there, and but I also made the commitment to them that when we were able to get back together and put a graduation together, we would include them in it. And so we're still working on that. We think we're going to do a graduation after this fall semester in the November timeframe, and we might have a multiple ceremonies so that we can include those that graduated this past spring as well as over this past August that again didn't have that opportunity to have their families here and walk across the stage and go through that whole ceremony. But we will we'll figure out how to do it by social distancing and again having multiple ceremonies. It's important for us right now as far as our persistence and trying to ensure that the students that started here in the fall are here next fall, as well as from the last fall. And so we're working on that. And one of the things we did is we used the chatbot feature over this summer, and that went out, sent messages out to our students where they could respond back, and we could capture that. And then based on some of the responses, we knew whether or not we needed to make a call immediately, or if it could wait till the morning, or if we just needed to send it to an advisor, someone, again, just to make sure of their well-being mentally as well as physically, and that they were still connected with us. From the university standpoint, we spent time obviously communicating to our faculty and staff. We've put together our return to Tigerland. I mean, we've been so optimistic about getting back here that we started working on that, and we continue to work on it. It's posted on our website, but in our office, it's written in pencil because we had to be pretty fluid with where this pandemic has evolved, and so. But we were always focused on trying to return to Tigerland in some form or fashion. We've lowered the density as far as the number of people that are on campus, but we are here on campus, and we never close, but we just now there's more of a presence even within our housing. It's the density is down, but we are seeing students coming up and down Tiger Walk. They're seeing me out there because that's probably one of the biggest things I missed was just being able to go outside and interact with the students. But we are committed and focused on bringing our students in here and providing them the education that they so deserve in an environment that where we're so family oriented and nurturing. We can't walk up and give each other hugs anymore. We might do an elbow pump every once in a while, but we're enforcing the social distancing. We're wearing masks. If I put my mask on and put a hat on, they don't even know it's me sometimes. But we all look a little different. But we're about the business of teaching and learning, and we're going to stay focused on that no matter what the outside forces are. And so definitely going to keep these students moving forward.
Dr. Pruitt, we Jarvis is a part of a small group of independent private Black colleges, and they don't receive any public funds in terms of state funds. Looking forward, let's talk a little bit about what the needs are going to be going forward, because we have the legislative session coming up in January. And right now we want to talk about policy and those things that are needed at the historically Black college level right now. Let's start with Dr. Pruitt.
Oh, thank you. And let me say that, as you said, being a private institution, of course, our students benefit from TEG, but any other public funds we do not receive. However, we do have some of the same challenges, and we do serve the same students as our other sister institutions do here in the state of Texas. And so we're always in need of state legislators and policies and really funding that will help us support students who have chosen a private institution for their institution of higher learning, but who are still citizens of Texas and who I believe should reap the benefit of that. As I said earlier, one of the things that has really been challenging for us has been the digital divide and the technological challenges that students have had to face. Of course, because we receive funds from the CARES Act, we were able to assist students. But it is our thought moving forward that there will not be a swift return to business as usual, which means there will more than likely be an increase in the use of technology as it relates to teaching and learning. And so, of course, we can always use assistance as it relates to connecting with our students and giving our students what they need as it relates to connecting with us virtually and in this remote teaching environment. There's always a need to, as we're looking for pathways for our students, always a need to have resources that support us hiring faculty members who can help us move our students through to a pathway that are current relevant for us. We're always looking for ways, even though we're a liberal arts institution, we do understand that we are also providing students opportunities to go into careers. And so whatever resources that we can garner from the state are always helpful. Infrastructure, buildings, instruction, we can always use that assistance in that, as I said earlier, we too are a part of the 60-30 that Texas is talking about. And we want to prepare our students to be a part of that Texas that is moving forward to enhance what happens for our citizens. And so any help or help and assistance that we can get from the state is always needed, always has been, and I believe always will be.
So it sounds like you support some elevation in the TEG grant, to elevate and add to the support that could come to private colleges and universities across the state of Texas.
Yes, sir.
Dr. Loston, same question.
I'm sorry, could you repeat the question for me?
Well, we're moving out. You've done so many innovative things, that's really helped in terms of connectivity. And I know that those things take resources, and that's generally comes through policy recommendations here at the state level. So we were looking at what are some of your needs that you think could be handled through policy recommendations.
Well, okay, policy recommendations. The one thing that we wanted to make sure is that everyone had access, no need to repeat it, but in having a connectivity. And we have, using our CARES monies, we purchased more than 900 higher end computers to give to our students, to loan to our students. But to make sure with the enrollment of 13,000, certainly we can purchase more. And that would totally eliminate the digital divide and the more hotspots as well, because one of the things that we did realize is that people didn't have connectivity at home. And then I'm using people in general because it was not just the students, it was some employees that didn't have connectivity at home that we had to address. So making sure that they have the technology, as we're talking about, since we're going to remain in this remote work environment, and we're certain that that's going to be the case possibly through all of next year, that we can satisfy the needs to ensure that no one gets left behind, everyone is able to fulfill their career goals. But in addition to that, for the students, making sure that they have the connectivity, it's being safe on the campus, to making sure that we have the resources to continue to support the PPEs, the disinfectants and the cleanings that are necessary. Because while we have the CTE students, those are the only ones that are on the campus right now. And those are the students that must have hands-on on the equipment, either by their accrediting body or their degree requirements. We still have to engage in the disinfectants and the cleanings. We've changed the way we're off the class scheduling patterns. So it's not just 10 minutes between the class. Now it's 30 to 40 minutes to allow the housekeeping staff to come in and disinfect the room before the next group of students come in, the next group of CTE students. So making sure that our budgets can be solid and where we can provide the support to keep the environment sanitized, clean. We've also talked about when we're talking about making sure the air conditioning, the filtration systems, because that is costing us, going to the MERV 13 filters that are in the buildings. And some of the buildings are older that we're not able to put in the MERV 13, but we're trying to move to that environment to make sure that we have clean, fresh air circulating. So we're having to address that. Those are operational costs that must be addressed. And so the help that you can provide there. We are also hiring health check screeners. So everyone that comes onto the campus is required to wear a mask. There are no exceptions. Unfortunately, we did lose an employee to COVID. And that speaks to us that we must be responsible people. And so if you're on the campus, students, even a vendor, you must be in a mask. We have a risk manager, and the risk manager has identified what our needs are. If the nation has Dr. Fauci, we have Jacob Kalunga. And Jacob, our risk manager, has done the social distancing, gone into the rooms to make sure that we have the separations that are necessary for the students that are on the campus, for the employees that are on the campus. We have the health check screeners that are testing everyone as they enter the building, giving them the wristband so we know that we have validated that you're not symptom, there are no fevers. So we're trying to do all that we can, but all of those protocols, they cost money. So if there's a way to the policy for filtration systems on the campuses, disinfectants that are on the campuses, it costs money. And then, so that can quickly deplete the operational budget that you had no plans for. And looks like we're going to be going into not a semester, but a whole nother year of dealing with COVID and the impact. And we know that we talked about the winter season and the flu is coming. And that may push us back to at St. Phillips, what we call, we're ready to go to phase 3, where we would bring roughly 25% of the students back on campus. Phase 2 is 50% and phase 1 is 100%, but we're planning to either go to phase 3, where we bring back more students onto the campus, or go to phase 5, which is stay safe, stay at home. And both of those are real scenarios, but COVID will dictate which direction we go in, but we're prepared in either way. But there are elements involved in terms of sanitizing the campus and making sure that we can do our best, put forth our best effort to protect the individuals that are on the campus and when they're with us. So those are some of the things that I would think that can help to drive policy to support the students, to support the employees, and then to support the work environment.
And what I'm hearing is connectivity, communication, and I'm hearing, safe campus.
Yes, the safe campus.
And President Huewitt, same question. What can we look at in terms of, policy recommendations to assist historically Black colleges here in Texas as we deal with COVID-19 and reopening and trying to get back to some space of normalcy?
Well, I mean, again, my colleagues have definitely laid out things, but I guess I would start off by saying this new normal that we're still defining is not cheaper, by no means. And so just trying to provide this, the modality of being online or a hybrid, it's still not cheaper. And so we've spent years working on working in a face-to-face environment. And for the most part, you probably focus on the brick and mortar and, and cleaning the buildings or whatever. But there's an infrastructure beyond that, which, this technology infrastructure that we're having to enhance to be able to provide this service in an online fashion. And even when you just think about Zoom meetings or we use Teams and Blue Jeans around here. But even when you talk about just the security of those meetings, I mean, you've heard of stories where people have bombed those meetings. I mean, so even your security has to go up. And so there's another cost of being able to layer that type of security measures. So it's one thing about the physical safety of our students, but now you have the technology, the security of your technology, so that we're not subject to those type of things. The other areas I would say is, we've all reduced our density, and again, this speaks to your earlier discussion about enrollment and retention and those type of things. We've reduced the density, but we've had to increase the number of sections that we've had. So a particular classroom no longer has 25 students in it. We might only have 10 in there, but I still have to teach 25 students, and so now we've added some sections, and so now you need more faculty, whether it be adjunct or whatever. So again, here's some additional costs that we're talking about as a result of this new normal that we find ourselves in. We're knowing that our students, how disproportionately affected they are. We've come up with a laptop program that we're working on, so that we can issue laptops out to them to help them with their connectivity, even if they're living in they're totally online and living in an apartment where they still need to be able to get online. The other thing is just, and I'll tell you, I say that because I know of students that are totally online. All of their classes are online, but they're in our housing. They want to get back. They want to get back to Tigerland as well. And so, they could have done this if they lived in out of state or whatever. They could have done it from there. But everybody wants to get back here. And again, until we can get back here in the right with the safety precautions in place. And again, we've got them in place, and now it's just enforcing the protocols around here, and getting everybody used to it, the new normal, if you will. But connectivity. Devices and infrastructure. And again, because it's going to take more staff, it takes more cleaning, even between classrooms now. I mean, we're cleaning between each classroom, and then we have a deeper clean after about 3 sections. That's more costly. I don't want to wear out my employees, that are cleaning these buildings. So we're even having a contract, and maybe they have a night service to come in to do an overall clean even at night beyond what we're doing during the day. Again, all this, it's always about cost. The bottom line is everything you're doing to make things better and make things healthy, safe, has a dollar figure on it, and that's not something that we can just pass on to our students. We need that infusion. I can just tell you that there's help that's needed. Again, we've had some assistance with CARES Act funding and those type of things, but those are one-time dollars, and we'll have to see what goes forward.
President Huewitt brought up a very interesting point, Dr. Pruitt. He said that the CARES Act dollars are one-time dollars. What about sustainability moving forward in terms of innovation and dealing with, what we've learned from COVID-19? We know that none of us will ever go back to being exactly the way we were before. What COVID-19 has done is actually forced us all forward into the information age, where some of our institutions were about 10, maybe 15 to 20% online, had to go from, let's say, 15 to 20% online to 100% overnight within a week. So now that we've been forced forward and understand that it'll probably never go back to 100% the way it was before, at a small private Black college, what are some of the innovative things that you all are deploying to help in terms of staying in the information age, moving forward, and sustainability?
Well, one thing we've done, and I've heard Dr. Huewitt as well as Dr. Loston mention, is that we understood that since our students did not have the necessary devices, that we would have to provide for them. And so we did purchase laptops and hotspots to mail out to students so that they could stay connected with us. Also, we are looking at how we do education. I've been one of those persons that always wondered what was magical about 15, 16 weeks. And so we're also moving now to more flex scheduling, as was mentioned earlier as well. One thing that has been really helpful for us is also us being connected with institutions who do online education 100%. So we've been able to be a part of consortia agreements that allow our students to connect with those institutions in a self-paced manner in which they can earn those classroom hours, earn those credit hours, and transfer them back into us. We've also had to make some allowances for some of the things we've done formally. We have an online degree completion program here at Jarvis Christian College, and we tried to really keep a strict demarcation between, but what we realize is that in this case and in the current events in which we are now existing, that we have to be flexible and kind of allow students, if they can, to move in and between those programs in order to be able to complete their degree. And so we're looking at various ways of helping our students get to the end of their educational career so they can move forward with their lives, understanding that the traditional ways of doing things will no longer necessarily be the way that we'll do them if we want our students to be successful. And at the same time, making sure that our faculty are prepared for the changes and bringing them in as a part of those conversations and what that looks like, as well as our staff. And so one thing that I think COVID-19 has done, it has allowed us to revision, to reset, and take a good look at what we believe Jarvis Christian College should look like as we're moving forward from this pandemic.
Dr. Loston, you have a unique situation. You mentioned earlier CTE, your career technology education programs there, and most of those courses are hands-on. And you also mentioned that you're dealing with it through campus safety. Tell us a little bit about the partnerships you have with industry, because I know industry can help with supporting students and supporting institutions, especially if there's a collaboration between the two.
Well, all of our CTE programs, are connected to the industry that they are preparing students for the career in. We have no program that operates in isolation. So all of our degree and certificate programs in the career and technology area, they're connected to the industry. They have advisory committee members that serve on advisory boards for us that meet at least twice a year, albeit now virtually. And some of them have continued during the summer where they were expecting to do clinicals, and even in the spring semester clinicals, rotations, experiential activities. Some of the industry were prepared to take the students, and then some of them said, no, not now. We are not prepared, because they were having to adjust with how they were dealing with their employees. And then some of the industries in the healthcare were saying, we'll take your students that are in training now because we desperately need them. So the partnerships have varied depending upon, if we're talking about respiratory therapy, well, or allied health and nursing, they would be respiratory therapy for sure. They were saying, we'll take your students. Even if they haven't completed their degree, we can use them right now in the field to support what's happening in the hospitals and centers. Other programs, the students were put on hold for completing their experiential activities or rotations because the industry that we partner with, they were not ready to deal with having the students on site when they were having to try to parse which employees would we have on site. So the partnerships have continued. It depends upon the discipline as to how they responded. And some were, as I said, the students were able to complete. And then others we're now having to do a reset where they're having to complete now in the fall as industries are coming back to capabilities where they can take in students to support them or allow them to complete their internship. So it is varied, but they do guide us in how we develop and strengthen our program so we can respond to and have a ready state workforce that can be employed. And with our students, our employment rate for students that are completing, it's roughly 93, 94%. So I say everyone that wants to work is working. And so we have great partners in this respect. But what I will say in terms of not only for our industry partners, what we're doing right now is taking the entire college through what we call a future search. And some of you have heard of the future search activity process. And this is, we're using COVID as an opportunity to take a healthy look and redefine how we're responding to students and the services that we're delivering. The future search process, we launched it. Actually, we began talking about it, but we launched it in August when we had a return to campus, the all college meeting, close to 700 people in a virtual environment. But we began talking about future search and what would St. Phillips College look like in the year 2030. How do these partnerships operate? How do we deliver instruction? How do we continue to deliver instruction to our students in a remote work environment? What does that look like from the students' perspective in terms of what are their expectations of us as an institution and making sure they can accomplish their career goals? What does it look like from the faculty perspective, from the staff and employees? So we engaged everybody in this research opportunity and future search, and we're doing the same with the students. And then we will integrate the data, and that will help inform how we go forward as a 2-year HBCU, and making sure that we have career pathways, continue to launch career pathways, and allowing students to accomplish their goals and what that is going to look like, because normal is no more. But I do thank all of the faculty that said my course cannot be taught hands-on, in a remote environment. So they're figuring out how to offer elements of those in a remote environment and then the other portion hands-on. But everybody has had to grow and stretch and be imaginative. And we're still looking to continue to define that and how we work with partners, vendors, and each other. So that's where we are right now.
I want to take this opportunity to thank all of you for joining us here. You've brought so much information and a wealth of knowledge to the discussion. And we're going to take this information and make sure that we do everything we can to help historically Black colleges in the state of Texas to not only just continue to live, but to thrive and do well at what you are doing. So I want to thank you on behalf of the Texas Public Policy Foundation and the Booker T. Washington Initiative for giving us your time, your energy, your talents, your resources, your knowledge and wisdom about what's going on with historically Black colleges and universities here in the state of Texas. Thank you so much. And I think that closes us out, right?